One of the things that a lot of places are looking at in the whole healthcare field is precision medicine, targeted medicine, right? And most of conventional would say it's a targeted drug for your, problem. Whereas here you're utilizing photodynamic therapy to precisely target disease cells and spare the healthy cells and tissue. Can you talk about how that works?
Yeah, so targeted therapy um, is I think in probably all the world it's most commonly known, like you said, oh, that's like a targeted drug, like a biologic drug that targets a receptor or a pathway or something, which that's true, certainly. Um, but when you get to what I call these physical level types of treatments, so that could be hot or cold or oxygen or light wavelengths, etc. You also have a natural targeting that can happen. So the I'll try and pick a simple example. Um, there is a similar process that happens between normal tissue and tumor tissue or tumor bed, and they could be right next to each other. But if you manipulate, for example, the oxygen in either of those beds or light wavelength to some degree, you get a different outcome from those cells. And it used to be wasn't that long ago, a decade or a little bit more, there were big concerns about, let's say, between a tumor bed and a normal tissue bed. There were big concerns about, say, red near infrared light or oxygen and the tumor bed, thinking, well, it does this with normal cells, which would be, helps them heal, helps them grow. Well, we wouldn't want to do that to the cancer cells.
Mhm.
True, that's logical. But then what the science has shown, and again, maybe especially the last 10 years, so this is another real big hill for people to get over often clinically. The science has showed, well, that's true. We wouldn't want to be promoting growth and strengthening tumor cells, but indeed, some of these physical or physical chemical actors, whether it's light or heat or oxygen, they actually affect them differently. So a normal cell might get stronger. Certain cells in the tumor bed may actually be weakened by that same thing, and they're right next to each other, right? So, and that's been a lot of especially the last, I would say, 7 to 10 years drive of a lot of my education is especially integrative clinicians who are likely to use these therapies to update their knowledge so they realize, oh, actually, these cautions we had about, certain light wavelengths in cancer were logical when we didn't know what we know now. But now that we know that they affect the tissues differently, we can actually give one treatment that makes the healthy part of you healthier and weakens the cancer so that maybe the immune system has something it can do there. And that's a huge paradigm shift, even for the integrative community. Because, like I say, a lot of that science around uh, no one really was looking, to say, well, we're really pretty clear on what normal cells get out of this, but we haven't looked at what cancer cells get, and they're different.
Yeah, and I mean, you heard that at the conference. There were a lot of questions from that crowd there in Isla about that. Are we really fueling, the cancer cells in this? And so there is this paradigm shift to understand how photodynamic therapy works within cancer. But I think the other thing I took out of that is that we have many more cancer cases. Have you seen that increase over the years for yourself? And also the complexity of those cases?
Yeah. Yeah, I think that there certainly are more cancer cases, just globally speaking. There's more pediatric cancer frequency. There's more adult onset cancer frequency at younger ages. So, for example, a cancer type that used to be more common 50 or 60 plus years old and we'd get 1 out of 1,000 would be 25 or 30. Now you're starting to see, oh, there's a lot more of that cancer in this younger, healthier group of people. Um, so I think the demographics of how cancer is hitting the population are shifting quite a bit. And what I would say just from, and I think statistics will catch up with this, but empirically looking at um, all of the people I work with, not just patients, but also the clinicians who are seeing lots of patients, um, the aggressiveness of either new cancers or reoccurrences of cancer seems to be much higher than it was previously. And so you'll get people that have a reoccurrence, which I mean, no one wants that, but sometimes, in the past, it might be okay. Well, we were successful with these treatments in the past. We'll do this for your reoccurrence. Now it might be a totally different type of cancer that comes, and it may come at a real high hot level, very difficult to treat. So again, this is where I think having the option to add in or mix and match some of these other therapies is really necessary because of the aggressiveness of the disease.